Good. So you can come a bit closer, or yeah. Okay. So the next technique is strain counter strain. Now I must say that strain counter strain may be applied in a slightly different way, or quite a different ways between therapists. The major idea of a strain counter strain, which is linked somehow to another technique that's called positional release, in which you're looking for a position that the muscle would release in an easier way. Yeah? So if, for example, you have someone who comes with pain and the muscle is quite tight, just putting it in the same position and massage it may not have the best result. And sometimes finding how you can help them to release the tension through a different position. And here is the vocabulary of strain and counter strain. If they have a strain in a muscle, you're trying to find a position in which you can counter strain the strain. So basically, just by positioning it and maybe applying a light pressure to overcome the strain. So in a way, what I will teach you is two techniques together. The positional release, to which position you are going to put the muscle in order to release, and how to counter the strain that the muscle overcome, okay? So just thinking about a muscle, I'm always thinking about 2 to 3 entities in the muscle. Okay? First, there is really the physicality of the muscle. So how tight it is, the stretch I can apply to it. That's one. Secondly, is the fluid dynamics that the muscle has. Say, fluid dynamics mean blood circulation, lymph circulation, and the waste product and the nutrients that comes with it. Yeah? So that's the second one. The third one is the nerve impulse coming from the brain. Yeah? So these 3 things, therapy can help. In one, you can stretch the muscle, yeah, or really petrissage it, yeah, so you're kind of laxing it and petrissaging it. You can increase the circulation by moving the fluid. And then, remember, indirectly, any technique indirectly you can use to reduce the tension that the brain sends to this muscle. Yeah? Now, in positional release and strain counter strain, what we're going to do now, it's really the nerve that you're trying to affect the most. You're trying in a way to reset the brain innervation to the muscle. And what do I mean? When the brain recognizes I'm in pain or something happened to me, there is an injury, it gets to set the muscle differently. It tightens it. It does not allow the natural movement to occur. How many of you have had a situation like that? Mm-hmm. Yeah, when you have an injury, and then for a while, even when the injury went away, your brain still thinking, wait a minute, I'm injured, don't mess about. Don't start moving it, it's too much. I need to be there and protect this area without really need. So this situation is quite difficult with the regular massage because you're not challenging the brain to change its perception. So what we are really looking for is to talk to the brain and say, that's all right, you can let go. And you need to use movement and massage in combination to help it to release. So there would be a lot of talking to the brain, a lot of feeling where does not want to go. For example, if someone has a strain in the shoulder would be tight, So just by saying, come on, I'm going to stretch you, the brain would say, wait a minute, who are you to know what to do? And you need to really go around in a way that you become friend with the brain, you listen to the brain, you make the brain feel good, and by then you lower the hesitation the brain has to let go. So you can't just go, let me stretch it, I'll show you, pain is good, and the rest of the things that sports and other massage therapy is saying to just convince the muscle that is fine. Because in a way, the muscle is held by the brain, and the brain think, I'm here in charge, I've been here way enough, I know this body, you're new to this neighborhood, back off. And it's really worked this way. The brain does not trust a big change right away, unless you're very good in your communication skill in your hands. So you really need to communicate. You need to not go against the flow, but really go with the flow. Go with the strain, which means sometimes make the muscle even shorter. And then, instead of stretching it by force, okay? I think if there is any questions, if not, we'll start really the first demonstration. Yeah, so maybe close that for a second.